Lovely.
Perfect.
Okay, so just welcoming you on behalf of the PPA. We've got Layla just arriving there. So really this is a welcome to kind of an educational event that's kind of pulling together a number of us who've been working together over the last few years. So this is really the next phase of a long-standing work to support clinicians working and planning to work in pain care, to be both recognised and supported in their careers, and ultimately to ensure and maintain quality of care for our patients. So really kind of came about from my side when Tim Noblet, who's here with us today from the APPN, contacted Rachel and I to kind of restart some of the work that had been done. This was back in 2023. And then the discussions have been building from then. And it's now a really amazing collaboration between the APPN, the PPA, the MACP, and the CSP, and everyone who's here tonight. So really, I kind of like that old saying, you know, alone we go faster, together we go further. So I think all of us working together is a really nice way to get started. So today is really about sharing where we're at, the process, what's been going on, and kind of hearing a little bit from Sharon and Caroline as well from the MACP about the process, some reflections of those of us who are piloting this with the PPA at the moment, and then kind of giving enough space for some questions and future and thoughts and where people are at and anything that kind of comes up. So it's a little bit of a informal sharing of ideas and events and reflections. So I am going to leave the introduction, but do feel free to put anything in the chat, to use the chat as you wish. We can monitor that as we go along. And if Layla's okay, I'm going to hand over to you for the first bit, if she's got in. We might have lost her again.
Looks like she's joining.
She's joining. Okay, otherwise, I think I'm going to start with Sharon and Caroline, if that's okay.
Can you hear me, by the way?
Oh, hi.
You're here.
Sorry. Right. I don't know why, but I can't use my camera and I can't get onto my laptop. So I'm just going to do the talking. If anyone from the PPA side can share the slides, then that would be great. But otherwise, I'll just talk through what was on the slides anyway. So I apologize to everybody who's on the webinar that I'm having technical difficulties. So firstly, a bit of background. Why did we decide to write the pain micro-credential? Well, we thought that it was likely that in the future, something would be written for pain clinicians. Bear with me 1 second. Can you hear me?
Yep.
Okay. Oh.
We've got a bit of an echo, Layla.
Okay,
that's better.
I hope that's rectified. Right, sorry about that. Okay, so yeah, why did we decide to write it? We know that the Centre for Advanced Practice was going to close the portfolio route by 2027. Although that has been extended now, as I understand it. We also thought that it would be very helpful just to have a pain specialist credential for those of us working in pain services or working largely with patients who have pain in any kind of service. And we thought that it would allow an alternative option as an alternative to a formal MSc pathway, because not everybody might be able to get onto an MSc. We also thought if we take charge of this ourselves, then we can shape it as an organisation and with stakeholders. The other reason why we decided to do it is because people like myself, who have been working in the field for a long time, I have done a pain masters, but I haven't done one of the recognised advanced practice masters. So it allows a pathway via the Route 3 pathway for us to get advanced practice recognition. And within the NHS, there's a very rapidly developing advanced practice agenda. And so, for example, most trusts now want assurance that their clinicians are working at advanced practice level. And this is another way of proving that you're working to that standard. And then lastly, writing the credential is also a way of perhaps informing future MSc programs that could be focused on advanced practice in pain care. Rachel, if you're doing the slides, could I have the next one, please? So, are there any limitations to this process? Well, yes, there would be a cost versus doing it via the Centre for Advancing Practice. However, if you were to do a portfolio route, it's potentially cheaper than an MSc programme, and also not all clinicians are able to access MSc. And I think it's important to say that if any pain clinicians or clinicians who have pain interest have already got their recognition through the Centre for Advancing Practice, it's not going to compete with that. You don't need to do anything different. It's just an option, an additional option to allow for flexibility. There is a sort of risk that adds a bit more complexity to the advanced practice landscape. However, I've just mentioned that all other routes are valid. And also we're doing this alongside the MACP, who've got a lot of experience and expertise in already offering the advanced practice for musculoskeletal standards. And therefore, I think this makes it a little bit less complex. Will it be suitable for pain specialists in non-MSK roles? Well, the stakeholder group tried to give this a really broad scope. So to make it inclusive for people working in lots of different settings. So for example, in hematology or pediatrics or in pelvic pain. So even if you don't identify yourself as being like a totally MSK background, we think that it could be applicable to lots of different settings. It will require dual membership of MACP and PPA. However, we think that being part of both of those organisations will bring benefit, and we really hope to work closely and collaboratively with the MACP on future projects, including education. Could you do the next slide, please, Rachel? So how was it developed? We drew together a stakeholder group, and this was comprised of representations from the 4 nations of the United Kingdom, representatives from higher education institutes, clinical academics, advanced practice experts and consultant practitioners, private and NHS practice. We attempted to bring in representatives from military settings, but unfortunately they were unable to attend. We looked at available existing documents, both related to pain. So for example, EFIC curriculums and International Association for the Study of Pain curriculums, and also the work that's been done within the PPA historically, particularly by Gail Sowden and Sarah Wilson. But we also looked at other existing documents that are available for advanced practice. So for example, the mental health advanced practice framework. And then the micro credential was written so that it would be in keeping with the 4 pillars of practice, but also so that it adhered to the standards of IFOMT. And there was liaison with the MACP, and shout out to Tim Noblet, who really helped us get the ball rolling on this one with his expertise and knowledge on developing advanced practice. and that is how they were written. So they were written, stakeholders' input into this to develop and refine the credential. Was someone asking a question, or was that just a noise coming in? Okay, so next steps are we are looking at a governance framework for the Route 3, which I think Sharon and Caroline are going to talk about in a second. So in the Route 3 portfolio pathway, there will be a Viva once the portfolio is handed in. And so we're just still finalising the details of governance for that. Jackie, who's on the call, and Tim have put together a publication just to describe the process of writing the credential. And hopefully that will be published in the not too distant future. There are a group of us from the PPA who are undertaking the Route 3 pathway as a test case. And we'll talk a little bit about our experiences later. And hopefully when we pass that successfully, we will be able to, the idea is that we could offer clinical placements to people who may be doing the Route 2 pathway. We may be able to act as examiners and also to support any members who would like to do this pathway. So whether that be in terms of mentoring or just responding to questions or giving people any other sort of support. And lastly, we recognise that there is a cost to this and there might be difficulties with this. So what we'd like to do in the future is introduce a competitive bursary to support members in taking the portfolio route. That obviously we won't be able to fund every single person that wants to do it, but we would like to support some people going forward. Okay, thank you. Thanks, Rachel, for the slides. That's me finished. Thanks.
Thank you, Layla. That's nicely, comprehensively put together. I wonder, we keep questions perhaps till the end, unless anyone's got anything burning, but please do put your questions in the chat. Otherwise, I'm going to hand over to Sharon and Caroline, who are very kindly here from the MACP and who have been supporting us through this test pilot procedure. So they're going to talk a little bit more about the portfolio itself. And over to you two. Thank you.
Okay, I'll share this. Is that working okay? Right, okay. Thank you for having us. I'm Sharon. I'm one of the portfolio route lead from MACP. I've got my colleagues here tonight, Caroline, who is also a portfolio route lead, and my colleague Tim Noblet, who has been heavily involved on these notes, working with PPA very, very closely to develop the micro credential. So we are here tonight to give you an overview about portfolio routes. So as you know, you can gain a AP accreditation in pain through the MACP route. As Layla mentions previously, is to map against the 10 dimension of IFRM standard. So we are going to give you an overview of that. Many people ask about what kind of examples we can include in our portfolio. So we're going to give you some example so that you got some ideas what can be used for your portfolio. Those on route 1 and 2 will include a mental clinical placement. So it's definitely is a great thing that you guys can develop a database that can support people who need mental clinical placements on route 1 and 2. What kind of support we can provide from MACP to support those on portfolio route journey. I would probably say we have this for about 12 months now, and as we go along, we are constantly, regularly changing things, evaluating things, developing things to really with the aim to support everyone better. we're going to go through the assessment process, and finally, we'll leave the Q&A to the very end, if that's okay. So, about 12 months ago, November 2024, MACP has relaunched the portfolio route. So historically, we only have 2 routes, and now we have developed 3 routes. And the reason behind is we want this 3 routes to be a bit more inclusive. So for MSK physio of different level of experience and attainment to become an MACP member. Also, this is apart from the e-portfolio, which is focused on ACP, this is specific for MSK. So it's an alternative recognized route for AP accreditation for MSK. Also is internationally accredited through IFORM and is fully mapped with what we agree on in the UK, which is the UK AP MSK standards. So it's a real demonstration of quality assurance and accreditation of your practice nationally and internationally. So there are 3 routes. Route 1 is for those who are in the early career, so at least 2 years of post-qualified in MSK experience. In your case, it will be in pain. For those, route 1 for those who hasn't got a full MSc. Route 2 is for those who has a full MSc. It's got to be a post-reg MSc and have 2 to 10 years post-qualified experience. In your case, it will be pain. So they are usually for like mid-career, so 2 to 10 years post-qualifications in pain. Route 3 is for those who are experienced with over 10 years of experience and have a full MSc. So as you can see, we are designing to be inclusive and to support people from their early career, mid-career, up to highly experienced clinicians. So try to put this slides for you to understand how are you going to have the double badge, basically. You're going to award 2 things. So like your exec members doing it at the moment, like Layla and Claire, you're doing the MACP portfolio route. When you're on a successful completion, you will be awarded as a full MACP member. So your practice has been accredited as an MSK in AP level. So as Layla said, they have developed a micro credential for subspecialties. So pain is one of them. So when you do your portfolio, you don't need to do it separately. Some people may want to do the first bit first, but your pain credential will be the addition, it will be the extra, which is obviously is focused on in your AP practice in pain, and consequently you'll be awarded in AP in pain. So essentially you will have 2 batch. Tim, are you on the call? Is there anything you want to contribute on this?
No, I think that's pretty clear. I really like your diagram actually there, Sharon. I think the thing to bear in mind is that as an advanced practitioner, you're never just purely in your specialist lane, are you? You are thinking broadly across all of these subspecialties as well as funneling down to your subspecialty. So people can sometimes get a bit, oh, I really want to just do pain. And actually, you can't just do pain, can you? Because you've got a person in front of you and you're assessing the whole person, whether it be biologically, socially, psychologically, from an ecological standpoint. So this is why actually all of the capabilities in practice are necessary. So I really like this diagram. It's really clear.
Thank you. Yeah, so everyone basically MACP, the MSK AP standard is like a core, so it's always in the middle. Obviously, we got the subspecialty to develop, so you guys will be double badged. So well done. So benefits of completing the portfolio. Most people do a portfolio, including myself, because I am a fellow of Society of Musculoskeletal Medicine for over 15 years, but I decided to do this as a quality assurance and verification to my own practice. And I'm so glad that I have done this. So most people really want to demonstrate that quality and governance assurance is the advanced practice accreditations, which is not just limited to England. So as you know, the e-portfolio is only limited to England, but this is go beyond that. So that is not just nationally, but internationally. You demonstrate that international excellence and standards by IFORM standards. To make it inclusive, we know MSK is not just about MSK, but we definitely want to be inclusive from people with different career stage, but also the subspecialty as well. There are plenty of membership benefits from MACP. So we are about to launch a online platform called CPD.me. So you can use that online platform to do your portfolio. There are plenty of one-day CPD days and free journal access, etc. Lastly, loads of people really like that flexibility. So we are all very busy with work-life balance. And so this is very much self-direct learning. If you are doing your route 3, obviously, if you're route 1 and 2, there will be a mental clinical placement, but you do have 5 years to do it. So it's flexible and it is accessible for most people in comparison to a full MSc, for instance. Sorry, by the way, this presentation will be provided to you in the PDF version afterwards, so I'm not going to read out every single lines. Another benefit is for service managers. So if there's any clinical lead or service manager here, we do have a couple of services approach us, want their team of physio who do the MACP portfolio route. Mainly is for quality assurance and also reduce staff turnover so that they train and develop their team. They're more thinking about the long-term workforce planning. So I'm going to start with portfolio route 3 because I think that is our most popular route, and so I think I'm going to start with this. Okay. So what does route 3 involve? It's a written submission. So route 3 is just the writing. So it's about you to collating a written portfolio, which demonstrate that knowledge, attributes, and skills and your experience. 3,500 words. And the reason I underline critical reflection, this is it's a critical reflective piece. So it's not just about describing your journey, it's about reflecting, it's about identify learning gaps and why you're taking next step of learning as a result of that reflection. So it is your personal journey, but the critical element is really, really key. As you think about how your 4 pillars and your evidence is about mapping against the 10-dimensional IFORM standard. So another top tips of this is really understand that 10-dimensional of IFORM standards. Think about the 4 pillars and how can you collect your evidence together in a critical manner. This is the IFORM standard. So these are the 10 dimension. I think it's really important to understand what is that involved before you sit down and do your writing. But myself and Caroline will really support you through this journey. So don't be overwhelmed yet. These are some evidence you can use. It's plenty. Okay, so I always say this is your personal journey and everyone is different. So think about some of your postgrad learning, any certificate like on master level modules, your case-based discussion, any reflection pieces, presentation, conferences, audit report, etc. So loads of them can really cover your 4 pillars. And often one piece of evidence can actually overlapping the 4 pillars. So if you think about, if you do a audit report, you will cover your education pillar, you need leadership, you need clinical, and you need educations to do an audit. So one piece of evidence can cover the 4 pillars, which should be interrelated in advanced practice anyway. I will share the I will email Claire about on the template. So we do have a template, which is a recommended template how people can do their mapping. It's not a mandatory thing, but we have used that on a number of candidates, and it's been very welcoming. So we are happy to share that. So following your written narrative, following written submission, it will follow by a viva. So the viva is not so much like an exam. It's really is about for the MACP assessors to have a set of agreed questions to get a bit more clarification and depth into certain area of your portfolio. So for instance, if there are some gaps or something about a little bit unclear on certain dimension or learning outcomes, the Viva is a perfect platform for them to get a bit more insight. So the fact that you didn't write in your portfolio doesn't mean you don't know about it or you haven't done about it. So these are a really good example to have a chat through a Viva process. It will be assessed at M level. Usually no more than 2 hours, and I promise you, it doesn't really feel like an exam. It's really feel like just as a chat, as a conversation, because you do know your portfolio inside out. It will be recorded by a consent because we do send this to our external examiner for moderation. These are the assessment process, just give you some guidelines. As I said, you do have 5 years to complete a portfolio. Most people in Roots 3, they can complete within 2 years, I would say, so far from experience. Usually you'll get your feedback within 8 weeks after submission. You will have your Viva within 4 weeks after your feedback from the written work. It have pass and fail. So pass basically means you have been successfully demonstrate the fully fulfillment of the 10-dimensional IFOM standards through your portfolio. The assessment and moderation is really robust, so we got external to do annually, and at the end you'll be awarded as a full MACP member. Okay, so I'm going to hand it to Caroline, who's going to talk a little bit about mental clinical placement. So this is really for Roots 1 and Roots 2. Caroline?
Thank you, Sharon. So welcome everybody. So yes, I'll talk about the mental clinical practice placement. So next slide, please.
Oh, well, it's not working.
That's it, lovely, thank you. So who undertakes it? So like Sharon said just a moment ago, so it's those people that are undertaking the portfolio routes 1 or 2. And it might also be other people that take these, the mental clinical practice placement would be people on the MACP accredited masters courses across the UK. And it might also be for those that just want to do it as an option. So who are interested in developing their clinical skills, they want the opportunity of an MACP mentor to work with them on that in practice. And so it's a really good opportunity to opt into it if you were doing Route 3, but actually wanted some clinical focus and development. So features of the placement. So the idea is it provides a structured, supportive placement opportunity for professionals. So MSK, or in the case of PPA members, perhaps more like localized to the areas you particularly want to develop, but also opportunity to showcase across the board your clinical reasoning and application skills in practice. It gives the opportunity for self-directed learning. You have mentorship and a chance to benchmark your clinical skills against those IFOM standards. And you learn from expert and experienced clinicians. So it's a really good opportunity to spend time with those with greater experience or different experiences to really develop as a whole. It gives a really good chance to reflect and refine practice. So reflecting on what you've learned already, where your journey, your unique journey to get there has been, what you're bringing yourself to that practice placement, and then consolidating your knowledge. Questioning often also why do we do what we do? Why do I do this? Why do I do that? What evidence underpins it? What theory underpins it? Just having really productive, engaging conversations with your mentor, and it's often quite a shared learning experience. It can be really positive on both sides. You have a self-directed learning contract. So mentees set their own objectives at the beginning, and these objectives are benchmarked against Dimension 10 of the IFOMP standards. So there's learning outcomes within Dimension 10, and that's what your objectives are mapped against. But your objectives are specific to you, so you tailor them for what you're looking to get out of the placement. And it's on those objectives that your placement will be marked against. And overall, the idea is to nurture that professional growth into advanced practice. There's always opportunities to learn and develop. Next slide, please. So in terms of what it involves 150 hours in total, and at least 40% of those need to be direct contact hours. So as a guidance below, direct contact hours might be time being observed. It might be time where you're watching somebody else. You might be doing it on a 2-to-1 ratio where you're with another colleague and you're doing some peer observation and peer working as well. And there are ways you can record your activity to help make up and demonstrate your hours too. So observation of the assessment and management that you're doing. It might be reflections on things you've observed, practical skills sessions. So if there's particular techniques or treatments or assessment procedures that you're wanting to learn and learn from somebody else and refine your own skills, it might be reflecting and having sessions of education there. Things like case-based discussions, or using a clinical observation tool, so you're getting feedback from your mentor about your practice or reflecting on your own practice, and you would share these resources with your mentor to learn and develop. And it might also be your clinical documentation as well. There's the indirect time might be time with other specialists, so you're not directly with your mentor, but you might be spending time with other people in the field to develop your skills and learn from them. It might be some independent study that you're doing and reflecting back and sharing with your mentor. It might be that you're preparing case studies or other aspects that link in with the placement that you're doing. Critical analysis of the literature that's relevant to patients or scenarios that you're seeing whilst you're on that placement, and writing up clinical reflections. And we have a number of tools in the MACP in order to help produce and demonstrate these. So we have proformas available that we provide to our candidates. Right, next slide, Sharon. So going on to those resources and templates. So these are the different templates that we have available at the moment. We're always looking to develop what we're offering and take feedback. So if there's something that people want in addition to what we provide, then we of course will provide it. But these are the tools based specifically for the mental clinical practice placement, but they might also be useful to use if people are generally building their portfolio outside of that mental clinical practice setting. And it might also be something, an example for Route 3 even as well. So we have got a recorded webinar specifically on the mental clinical practice placement. So that's on the MACP website, and it's open to everyone, not just our members. So you are able to access that, and the link will be within the PDF, and it's on our website.
Thanks. Yay.
Thank you both. That's really helpful just to see the process there. Sorry, Sharon, have I interrupted?
No, that's fine. Just yeah, I think we just finish up with some top tips basically for portfolio. So it's all about consider your 4 pillars of advanced practice. I think through the experience the last 12 months, understanding of the 10 dimensions, consider that diversity of evidence that we mentioned. It will be assessed at master level, so understanding about master level assessment and marking is important. It is about your personal journey, so it must include the critical elements, references. Protected time is also key. We are all very busy, so having some time aside to do this. You do have up to 5 years to do, which is all routes. Route 3 not really anticipate to be 5 years, but those may be on placement, they may need a bit more time. Peer support is important, like your community and PPA is a great example. And MECP, of course, will fully support that. And yeah, so I think it's a demonstration, like we said, advanced practice accreditation aligned with international standards, and hopefully hope you will find this helpful in our presentations tonight, and we will send a PDF version. Thanks.
Thank you, Sharon. That's brilliant. And there's so much there. We don't. Hopefully, people are not getting too overwhelmed here with all the information. I'm aware of time. We've got about 20 minutes left, and I do want to leave time for questions. But what I'd quite like to do is just spend 5 minutes or so with those of us. There's 5 of us who are doing the test at the minute from the PPA, and just to maybe if the 5 of us come on and we just have a very brief conversation between us on perhaps what's been good about it, what's been challenging, and maybe any advice we would give. So anyone want to kick off on, should we start with what's been good? Selena, you look like you're about to say something. So
I just don't want to talk over anybody else. You never want to be the first to jump in. I think what's been quite good is being able to reflect on your own practice, really, sort of identify sort of areas of strength, but also areas for development. And I'm looking in my next stage in my career at doing a postdoc application. So that's really relevant for where I'm up to at the moment. So it helps me to focus and to shape that next step as well. And I think what I think sometimes we're quite good at reflecting maybe on our weaknesses, but reflecting on our strengths and articulating that as well, I think is something that really has been a nice thing to sort of try and explore. So yeah, I'd say they've been some of the things that I've learned through doing it.
I would agree with you there, Selena. I think it's been quite an interesting time in my, I'm kind of definitely route 3, 30 years qualified plus, and to actually think on the things that you have done is not usually where you go. And to actually put it all in one place. I mean, there were challenges in terms of collecting things and the time and pulling together and actually kind of working out what it is that we had to do. That certainly has been quite a challenge. But overall, in terms of kind of passing the information down to others in my team, and that's been really useful to kind of know what's involved. Elsha.
I think what's helped was there's a little group of us, so we set regular meetings and that check-in where it's motivating to hear what others are up to. So that's something I would certainly try and get a little group together and have check-ins to support each other and just share things you've taken from the last week, and also set little goals. So it was definitely, and I certainly took study leave days so that you have every couple of months or so you just do a piece of work towards it. So that's something that worked for me. But the support from a small group of other people going through the same thing was really helpful.
Go for it, Layla.
The support from, I have to also say, from Sharon and Caroline has been really, really helpful. And I know they're both extremely busy. So, I'd just like to say thank you. And that's helped us on this journey as well. And I echo all the other comments as well. And I agree. It's actually really useful for your own reflection and learning and thinking about what next stages of development for yourself as well.
Jackie, anything?
I think I should
Want
go.
to throw in?
I think there's something about the breadth of experience that I had forgotten about. Things that you might have done, but you thought that's no longer relevant to my practice now. And what this really allows you to do is to zoom out and to note the areas of practice where you do have quite a lot of evidence that it's just become part of what you do now. I think a lot of us have found ourselves in this position where we're going, I just show up to work and I do what I do, but having to pull up your job description and then go, actually, I might need an updated job description. It's been quite helpful, and seeing the evolution of practice over the years for me, you know, starting off from some of the strange things I used to do when I was a little bit more green in my career, and things that we've let go of, but still, you know, it's quite nice to look back and go, I see where I've come from. It wasn't just you know, I didn't just land here fully formed. And again, echoing what Sharon said, is this surprise at how much evidence you might have without, but you know, going through the dimensions, it just really allows you to link. So something like an appraisal covers quite a lot of the different dimensions, and a paper you've read covers a number of dimensions, especially if you've shared. And I really appreciate that it maps to the 4 pillars, which comes up a lot in our kind of normal appraisals and job interviews, etc. So I found it really, really helpful.
Thank you. And I think I would echo that, Jackie. You know, when everyone's doing your PDRs and you're constantly putting things in the 4 pillars, all of that is going to be, in a way, quite easy to pull the evidence from, for going forward. Okay, thank you for sharing. I mean, I think we could talk for a while on that, but we're getting there. We probably started about a year ago. I think we actually, we probably had three, maybe 4 meetings with Sharon and Caroline, which has been brilliant to have those check-ins to keep us on track and to see where we're all at. But I want to spend the last 15 minutes really to open the floor out to questions, and I'm going to hand over to Rachel to chair that. So please do feel free to put them in the chat or shout out.
Being the taking the position of the chair of questions, I'm going to ask the first one. So I wondered, I know you've all said that you started a year ago, and I think that's about right from what I remember. How much time are you finding yourselves putting into being able to do that? Because I know Sharon said that, you know, you've got 5 years to complete your portfolio. I'm getting the sense that with all of you, you've nearly done completing your portfolio and you're hoping to submit it. Is that roughly where some of you are at? So that's taken you only a year, because all your evidence is already there, and I guess you're already working at what we might call an advanced level anyway. You're already doing some of those roles. Is that fair to say?
Yeah, and I think that was the value of this. Like Claire said, we are very conscious that, for example, as a manager, if I'm employing people, they might come from an MSc course that is MACP accredited for advanced practice, or from a pain course that is accredited. But for those of us who have been in practice for a long time, we might have done particularly pain MScs, were not necessarily accredited at the time. They were what we did to build our technical skills or our knowledge base. So people might have quite a lot of experience, knowledge, skills, and they might be doing jobs that over time, I'm not sure about you guys, our job descriptions, our job titles evolve. You know, I don't really know, clinical specialist one week, ESP the next week. And now we're kind of settling into this language of advanced practice, which our NHS trusts are really keen on. So they're kind of clamping down on this kind of everyone has their own random job description. So for me, it's been like, I know I do my job, but because I know there's a changing agenda, there's certainly something about reassuring my team that we agree you are a great pain physio. It's just that if you left this trust and went to another trust, how do I assure them that you haven't been, you know, making pots all day or something like that? So I think it's certainly something that I've considered. I've completely forgotten your question, Rachel.
You've got there, Jackie, in the sense that the only other thing I was asking was how much time you find you're spending on this. But I guess if you've got to the point of a year, it's not, it's probably comes in fits and starts, doesn't it? Elsa said she has a day when she might take some leave to work on it. Is it?
And I think it depends on your personal learning style.
Hmm.
I'm notorious in my last minute. I can't grow out of it. So I really value the deadlines or the meetings we have as a group, as a collective, because it reminds me I need to spend some time this week so that I can report back that I've made some progress rather than my natural tendency, which is to wait until someone shouts at me. That kind of support throughout has been invaluable for me.
And
Thanks, Jackie.
I think with the 5 years is the bit of the blanket guidance for all the routes. So obviously, if you're very route free, like a few of you guys here, you already have a lot of evidence, and all you need to do is a written narrative. Well, still on route one, which is more the early career in pain. Route two is more like mid-career in pain. So they may need to do a few more things, and the
Yeah.
placement to demonstrate all the mapping. So that could take a lot longer because the placement itself, you may need some organization. They may only have 1 day a week for the next 6, 7 weeks to do it. So that is the reason why we say 5. But if you're route free, like I said, I think most people would finish within 2 years.
Thanks, Sharon. We've got a couple of questions in the chat. So Eleanor's asked, is there any support to evaluate best route, existing appropriate evidence, and what might be a small or possibly large element to focus on evidencing? I'm not sure I entirely understand the question. I'm going to be honest, Eleanor. I don't know if anybody else is getting a sense of that, or did you want to say something? Hi, Eleanor.
So it's taking forever my laptop to do anything. Hi, no, it's really, I'm just trying to establish what I might need to do and what might be the best routes, just because I might not have the most obvious place where I'm at the moment, but I'm pretty certain this is where I want to go to, and I'm just not quite sure where. So is there any support? Is there some event? Is there somebody you can book in with? Is there something there where I can say, look, this is me, this is bits I'm pretty confident with. I'm not sure actually how I get this bit together. What would be best? Would it be best to go do modules, or would it be best to go down the, the placement type thing, or what? So get that advice really.
It's a really good question. I suppose at this stage, because we've got our 5 test cases who are all about to finish, I think after that, we'll have a little bit more of an idea of being able to work that out with people, and maybe an opportunity to be able to speak to somebody from that group alongside somebody from the PPA, to, not that we aren't, but just to try and work out that situation. And also, I'm sure, Sharon, Caroline, do you do that for people who are looking at doing the MACP as well, if they were not doing the advanced practice in pain section?
Yeah, anyone interested in the portfolio route would submit a checklist with some of their backgrounds to give us an idea of what route they'd be best suited to or eligible for. And then we'll meet that person. It's normally a half-hour Teams call to chat through their journey and where they're at now, what they're wanting to get out of it, and answer questions, provide some information about how the mapping process works. We sort of talk through the whole process and tailor it to that individual. And normally by the end of that conversation, if not before, we know what route is right for them. And that's what generally we share in that first appointment. And then it's up to that individual if they want to take things forward from there.
And I think when we come to, now that we've got this AP or the pain credential on the side, it might be a joint conversation that then sits there and says, yeah, this is where your particular role in pain sits within this, and that makes sense for you to go that way or this way. I will make a caveat and say at the moment, a pain sort of specific placement isn't quite there yet, but we're looking to be able to develop those things. But we needed some people to become advanced practice pain MACP before we could do that, because we can't have somebody on a placement where the person that's reviewing them or mentoring them hasn't done it themselves. That doesn't make any sense. So we've got to get there first, and that's where we're going. And And then obviously the earlier career route will come as well, but we anticipated that there would be more people at this point wanting to do this and necessary for us first. So that's why route 3 is being done first. Another comment, I'll take that one from the chat, is from Ethel. Thanks, Ethel. I think the idea of a little community for accountability is really helpful. Is there a way this can be facilitated? Maybe a database of people going through this at the same time? Yeah, Claire, any thoughts? I think that's probably what is likely to end up happening. It makes sense that there might be a group of people that, again, feel comfortable doing it together. I think it wouldn't surprise me. We haven't got anything formal, but I'm sure that's something we could put links together through the PPA.
I'm sure that's something we can almost do, a little community of practice on the website or something, or where there's, you know, we can dip in, or those of us who hopefully get through this and can kind of, you know, do further mentoring or coaching or whatever is needed. But that has been very helpful, just to kind of share and also to learn from each other how people do things. You know, for me, I'm very, you know, I'm somebody who starts and I just get way too much, and then it takes me ages to kind of get it down to what I'm actually doing. So, you know, and even to somebody to say, like Ethel said, I'm booking some study days, I was going, oh, I didn't think of that. And, you know, actually getting the time properly where you're not jumping from one thing to the other. I think that's what's been very hard on this. And it's been very useful to pull together and check in with each other, because you don't often get a stretch of time where you can just focus on one thing. And for this, in a way, you do need to do that. You know, you're constantly doing, well, I'm constantly doing lots of different things at the same time. So that's been quite helpful. But yes, I think we would definitely think about that.
And it does work. We also have a group from Ireland, from CSP in Ireland. They've got a 10 bursary place. So we're doing very similar to PPA group, and every so often we meet all of them, a group of 10, and it's really good to have that support. I mean, everyone works like it's just to share the experience, etc. Obviously, if you want to have an individual chat, myself and Caroline can always do, but a community of practice idea is actually really brilliant.
Another question. Thank you for thanking us, first of all, FH. That's really kind of you. You asked when each of the 3 routes will be available for others to apply. As soon as we've got our little team through for test case for route 3, I think we will be in a better position to say at that point that we've got something set that works, that we can then, and then we've got people who are available to do the mentoring, and people available to become part of the Viva team for people with the pain credential. So once we've got that in place, then route 3 will probably be available to everybody else. We'll start to open up. I'd hope. It's hard to put a date on it because I'm not sure when everybody else is going to finish their own piece. Tim, we're sort of probably looking, I think it'd be fair to say it's going to be early next year before it's open to anybody else at the moment. Would that be fair?
From feedback from the ladies who are doing it and the ladies at the MACP, I would say that's probably about right, isn't it?
Yeah.
Because the portfolios will need obviously finishing, a couple have finished, marking, Viva, and then going off to the university for that part. So I think it's exciting. I think it will come quicker than we think. But yeah, definitely 2026 towards the beginning.
So that will be route 3. The application process will be, it's because you're doing the AP part of it, it's still through the MACP, but it's a recognition that you're doing the pain credential part. So it will be the same process to say I'm doing route 3, but I'm doing the pain part or the pain credential. So it'll be it's almost a joint application because we're working together on it. So we will both know, or both teams will know, that you are applying to do that. And then the negotiator, you'll be supported by both, because there'll be some parts of it a little bit more pain specific and some of it will be more about mapping elsewhere. I'm going to be honest, we're still working through this. It's not set in stone yet. Is that fair to say, everybody? Because this is the first time that 5 people have done it. So we will take it from there. Jackie, you've got your hand up on that.
I think it's just to let people know, just in terms of preparation. So it's October now. We thought it's a really good time to get people's minds thinking, particularly, as Layla said, we know that the route via, I want to call it NHS England, but that's not quite right anymore. But we know that that is not very certain, and it's open, it's closed, and etc. So this is an opportunity for people to suss out their options, to go onto that MACP website. I think watch that webinar about people from, people's experiences from the different routes. And it's also an opportunity to set yourself up in terms of your personal life and your employer. And is this something you need to, if you're going to negotiate some study leave, you might need to apply for. So if you work in the NHS, for example, we've still got, I think this is our 3rd year of funding for CPD. So it's a really good opportunity to, if you're starting to think about things, that you're in a good position to hit the ground running once things are opened up. Because I think there is that kind of logistics of how do you get your clinics set up? How do you get your mentors set up? That kind of thing.
Thanks, Jackie. Caroline, and then Layla.
Yeah, so following on actually from what Jackie said a little bit, she pinched what I was saying, so she moved on. But no, just about the preparation that people can do now if they're interested in doing it. I mean, there's lots of resources out there, and like familiarize yourself with the routes, look at the IFOMP standards, watch the material, look at the material that we've got already, and it can be time now to do a bit of a learning needs analysis, even just like an informal learning needs analysis, and look at the criteria, look at the pain micro-credential, and see where you feel like you're stronger, where you feel like maybe you need development, and that might be things you can start talking to your line manager about now to start heading in that direction and building evidence now, so you don't have to wait till you get started. If you start now, then when you do enter the process, you're a step ahead.
Thank you both. Great tips and thoughts for getting prepared for what will hopefully be available come 26. Layla?
Just a couple of things to say. One is, although we're just finalising the arrangements of exactly how it's going to work, I just wanted to assure people that it is a very rigorous standards, and that everything that we're doing is adhering to the IFOMP standards, and again that the MACP are extremely experienced in running these pathways. The second thing is that the credential, the pain micro credential, is not only based on the 4 pillars of evidence and existing documents that are already available. It's also very much based on clinical practice of people working in these roles.
Yeah.
And it will, we hope, inform an advanced practice master's in the future. So as that may be some years away, but that would be the route to membership as well.
Thanks, Layla. I'm going to ask a slightly loaded question, I think, because Sharon and Caroline mentioned, preparing yourself, and Caroline said, have a little look and do an analysis against the micro-credential. We haven't published that yet. How close are we? What was our timeline? I'm doing that on purpose. I've got a bit more of an idea.
Layla, it's out, isn't it? It's already out, and
Brilliant.
Yeah,
it's on the website. I'm looking at the website, people.
That's great.
So the work that Tim and I are, and well, quite a lot of us are writing up, is just to help people understand the rigor that Layla's talking about, so people can see that it didn't just pop out of nowhere. It's kind of got this foundation, and then you can use that, I suppose, in a more formal way as a reference to go, okay, here you go. Here's an actual, what the world is like. But it is definitely available now on the website. You can tell I'm very
on
clear
which
about
I
website,
didn't.
Jackie?
Say that again, Jamie.
On which website?
On the PPA website.
Nope.
Nope. Where so at the last meeting,
It's soon to be available
soon
on
to
the
be, there
PPA
you go.
website.
See, I knew there was a
I
good
should
reason
really
for me
know, shouldn't I,
asking.
as a website officer? I'll try and find it.
We'll
It
get
will
it to
be
you,
there.
Jamie, very
It's
soon.
So that should be another start process. That will give us all an opportunity, or give people an opportunity to start to think, okay, where do I sit around this? Yeah, where do I sit around that? Sharon's kindly put current costs up. So route 3 at the moment is £500. Which, as we said before, whilst there is a cost, we're also thinking about the fact that we need rigor at this level, and therefore that investment in what we're doing makes sense. I know it's going to be difficult, but at the same time as saying that, I suppose if you were to put it over 2 or 3 years worth of CPD, it doesn't work out as quite so much money. But I think it still works out. I would say, I haven't done it, but I would say value for money. There will then be a yearly cost for belonging to, obviously, the PPA and the MACP, and to keep you on the register. So to keep you as a registered advanced practice in pain physiotherapist, there is a cost to be able to stay on that as well. I think we're still at the moment sorting out how that cost will be sorted between the MACP and the PPA, because there's an acknowledgement that somebody would need to belong to both to have the advanced practice pain mnemonic. Any other questions? I'm conscious that we're just after 8 o'clock, 5 past. Is there anything anybody else wants to comment on? Tim, lastly, the only other thing I wanted to perhaps bring up was just the fact that this situation with advanced practice is also now being, and this collaboration between us and the MACP is now being looked at quite closely as well and endorsed by the CSP, whereas previously, I suppose, you know, if we were looking at this a few years ago, they weren't particularly interested in what it meant to be advanced practice in different areas, but they are now showing a little bit more interest in joining us, and they're really keen for our process to go ahead. Am I correct in that, Tim?
Yeah, there's definitely a big piece of work that's going on in the CSP at the minute, looking at all specialties and subspecialties of physiotherapy. And this kind of work, there's a big mapping exercise going on, and really, you know, the MACP and the PPA are at the forefront of getting this sorted before anyone's even asked us to. So it's fantastic. I would say what is amazing about this work, and it has been for the MACP, is that the credential can be used to advocate for your subspecialty and specialty across kind of the public sector, private sector, military, so on and so forth. So there are conversations going on with private insurers where if you have the credential, you'll actually be able to get a larger cut of the money as a physiotherapist. So hopefully it's going to take our profession forwards, and instead of sat back waiting for someone to do something for us, we're on the front foot, and we're getting it done, and we can take the next generation forward and then let them do their thing, and hopefully we can all sit back and retire and put our feet up.